Today's theme is about communication, and hopefully the rest of the day will go smoother. Um, I just want to briefly review the vision and mission of the Center for Chronic Disease Research and Policy. Our vision is to create a world where healthcare research and policy seamlessly interact to improve the health of individuals at risk for or living with chronic diseases. That's certainly a vision and not reality. And our mission in achieving that vision is to develop and study innovations in the care of individuals at risk for or living with chronic diseases, and to influence policies that affect the financing and organization of care. So today's theme is around public health communication, which we've experienced a lot of in the last 2 years during the COVID-19 pandemic. What is public health communication? Public health communication are a collection of communication strategies that are designed to influence and empower individuals, populations, and communities to make healthier choices. Public health communication is behind our efforts to control nicotine, alcohol, drug abuse, self-care behaviors like exercise and diet. But during the COVID-19 pandemic, of course, it was around mask wearing, uptake of vaccinations. The challenge is that public health communication was hard to begin with decades ago, but in 2022, we live in a world of multiple news platforms, social media, and a really highly fragmented, segmented population, both in terms of public health understanding, politics, and so on. So we have the challenge is also that we have more evidence than ever about how to prevent and control diseases. We have more treatment options than ever before for any given chronic disease. And this evidence is constantly changing and evolving. So that makes the communication around behavior change ever more complicated because we have more evidence than ever to share with people. So the purpose of today's symposium is to discuss, what's the latest science regarding effective public health communication. What did we learn from the COVID-19 pandemic that we can utilize for the next pandemic, which is unfortunately likely to happen again? And what do we do about the new, about misinformation? Not just positive information about behavior change, but what do we do about misinformation? So we're hoping that our panel of speakers today will be able to address all of that. So I just want to share a slide from a paper that I found from Science Reports, from actually a data science group that's led by a physicist of all people. And this is data that comes from Facebook. And the paper looked at Facebook data around different groups of people before and right before the availability of COVID-19 vaccines in late 2020. They divided the groups into different segments. The blue group are people that were very pro COVID-19 practices, masking, social distancing, and uptake of vaccinations. The red group were completely opposed, even before the availability of vaccines, to all of that. That's the red. Those are the red group. Each of the dots represents a group of people in Facebook, and the lines represent the social connections between the groups. In the left lower panel C, this is actually in November of 2019. You can sort of see there's a red group to the lower in the southwest quadrant, and there's a pro group in the northeast quadrant. And there are actually in between groups. For example, there's a group concerned about parenting in the blue, and there's a group that had a lot of existing illnesses that had sort of different interests around COVID-19. And then on the in the D panel on the southeast of the slide, this is what happened basically by December 2020, after all that had happened in the early first year of the pandemic. What happened was there was actually contraction of social behavior, so that the groups actually tightened up. There was actually more. There's actually less interaction between different groups with different beliefs. And by the end of 2020, some of the parenting group had been drawn into the red group as well, becoming anti-COVID-19 best practices. And this sort of the paper's a little bit sad because it basically said we may have been set up to lose in terms of public health communication from the very beginning because of the social segmentation that already existed well before the pandemic. So this is what we have to overcome, but this is a sort of a window into the new data that we have available to study spread of information, new data around social networks and how they function to spread or inhibit spread of positive information or spread or inhibit misinformation. So this is the schedule for this morning. It's going to move very quickly. We'll have talks by Marcia Tan, Jasmine Tiro, Harold Pollack, all from Public Health Sciences here at University of Chicago. And our keynote speaker will be Dr. Allison Arwady at 11, Director of the Chicago Department of Public Health. We'll have all the 4 speakers for a panel discussion from 12 to 12:30. And after this, we have actually over 20 posters on the second floor and lunch as well on the second floor from 1 to 1:45. We hope that you'll interact with people. One goal of the meeting is to interact with someone you don't know. And the purpose of these symposiums is to bring together academics, clinicians, and policymakers all in one place so we can have an exchange of ideas about big, gnarly problems that we face. So I just want to also highlight a few opportunities that we have available connected to this center. And one is there's a couple pilot grant opportunities. One is from the Chicago Center for Diabetes Translation Research. This pilot award program comes out every single year. The current upcoming deadline is November 11th. And please reach out to Annette Hanna, that's her email address, for more information about that pilot grant program. Dr. Vokes mentioned that last year we were awarded one of 11 regional multiple chronic disease of health disparity centers from NIMHD, and we've already awarded 6 pilot grants earlier this year, and our next round of pilot grants are due December 1st, 2022. There's the link for the pilot grant program, and we also have rolling acceptance of mini grants of $3,000 if you want to work with a community-based organization. That money is also available. The pilot grant program it ranges between $50,000 to $60,000 per year, depending if you're working with a community organization or not. And then also I want to mention that under the leadership of Dr. Lai-Tirpong, we have the Pitch Fellowship. We're now entering our third round, or next year will be our third round of fellows. We already have our first 2 rounds of fellows. And the goal of Pitch is to train the next generation of primary care clinical investigators to improve health outcomes and care delivery for patients with chronic diseases from underserved backgrounds. So these are 2-year fellowships for people with backgrounds in internal medicine, geriatrics, pediatrics, and infectious diseases. And the money comes from HRSA, and each fellow trains for 2 years. So here's the link for the fellowship program for that you should look for next year. And please stay in touch. These are the different ways that please fill out the evaluation forms so we can plan for the next 10 years of Symposium. We have a YouTube channel. This program will be recorded and available on YouTube. We have past programming also from prior Symposia. Please check our website for ongoing workshops and opportunities, and also follow us on social media as well. We now have a great communications director, Irene Shao, who is in black with her camera. So thank you very much. I want to quickly segue to our first speaker,